May I begin by recognizing the Honorable Minister of State for Health, Dr. Senator Olorunnimbe Mamora, Dr. Professor Fabian Akinwale, in-house Deputy DG and representative of researchers on NIMR management team, a Director of Administration, Alhaji Yusuf Zazao, other principal officers of NIMR, Medical Director, Federal Medical Center, Dr. Dada, Medical Director, Godi Orthopedic Hospital, Dr. Mustafa Alimu, members of NIMR Senior Management Committee, members of the NIMR family, distinguished members of the press, distinguished ladies and gentlemen. May I once again welcome the Honorable Minister of State for Health, Dr. Senator Olorunnimbe Mamora, to our little London in Lagos on this occasion to commission and showcase the new next generation sequencer, which was acquired through the support of Federal Ministry of Health using the Federal Government COVID-19 Intervention Fund. We have therefore been able to establish a full genomic sequencing laboratory which is capable of supporting the NCDC in their genomic surveillance, and more importantly, our genomic research in all ramifications. Let me put on record that it is exactly a year ago today when the Honorable Minister visited NIMR to commission 2 of our projects. The Nigerian Institute of Medical Research is the foremost medical research facility in Nigeria, which comprises of 5 research departments: the clinical sciences, microbiology, public health, molecular biology and biotechnology, Department of Biochemistry and Nutrition. You will recall, sir, that our institution has indeed made significant contribution to the COVID-19 pandemic control in Nigeria via our innovation and development of RNA extraction kits and 2 COVID-19 test kits, one of which can deliver results in less than 40 minutes. Our challenge in coming out with this early is related to our inability to carry out full genomic sequencing of the Nigerian strains of the COVID-19 virus. Today, this challenge is put behind us with the acquisition of the next generation sequencer. Already, we are at the final stage of developing our kits for the diagnosis of Lassa and yellow fever, which will be cheaper and can be made available to hospitals in Nigeria. What we need to encourage us, Honorable Minister, sir, and other scientists in Nigeria is the political and policy backing for the use of these homegrown contributions to science. Many of these are bound in Nigerian universities and research institutes. Although COVID-19 vaccines are now available around the world, the continuous mutation of the virus, forming new strains and variants of concern, has made development of new vaccines inevitable. Our institute, in collaboration with the Olorunnimbe University, the National Veterinary Institute, JOS, have recently formed an alliance to begin robust research on vaccine development in Nigeria. We have approached TED Fund through the Olorunnimbe University for support in this regard. The platform will create a template for vaccine development generally in the country. While NIMR is currently using Gibson assembly cloning in developing multivalent peptide subunit vaccine against SARS-CoV-2 virus, with Olorunnimbe University is employing bioinformatics and nanotechnology to make DNA vaccines, and National Veterinary Institute is using reverse genetics in engineering new Castor virus to express SARS-CoV-2 spike protein. This is a serious effort to be supported by government. If not for COVID-19, it should be for capacity development for future and current vaccine challenges in Nigeria. Honorable Minister, sir, I therefore request your humble self to visit the two other institutions to encourage the group and campaign support for funding the group through your networks and other available means. Today, sir, a new next-generation sequencing machine with robotic nucleic extraction and sample preparation system at the Nigerian Institute of Medical Research will be commissioned by you to support the country's efforts in real-time monitoring of mutations of SARS-CoV-2 in country. The machine setup will not only serve in molecular surveillance, but prepare us in the fight against other infectious agents such as Lassa fever, yellow fever, Ebola fever, and any other infectious agents characterized by the genetic code. I therefore encourage our scientific community in research institutions, healthcare facilities, academia, biotechnology, and pharmaceutical industries to work together with NIMR to ensure we make efficient use of the NGS machine to produce the much needed sequencing data for public health decisions in Nigeria. Once again, Honorable Minister, you are welcome to NIMR. Long live Nigerian Institute of Medical Research, and long live the Federal Republic of Nigeria. Thank you very much.
Align myself with the protocol already robustly established by the DG himself. So, in that regard, I will just say, colleagues and esteemed laborers, which we all are in the vineyard of health, media representatives here present, ladies and gentlemen. I think first, let me address the issue of the political support raised by the DG. I can assure you that we continue to do our best in this regard, because when you get better, then the ministry gets better. I do know that tomorrow, the Central Bank of Nigeria is disbursing some support from groups, my understanding, within the health research community. That is one of the avenues that we can explore and exploit to give you that support you need very badly. And we will not be able to do that as soon as possible. And maybe by way of an aside, and listen very carefully to the MC. The name is Mamora, that's the full pronunciation. So that you don't start pronouncing it in the way that people will be wondering, where is this man from? The name is Mamora, that's the full, but when you shorten it, you remove the W-O, it becomes Mamora. Not Mamora, or Mamora. I'm still in Nigeria and a Yoruba man. Let people start thinking that I'm Chinese. Thank you very much. I'm here to be, well, very happy to be here again. This is my second time or third time thereabout. But today, what we are witnessing marks another giant step. A step forward in our quest to increase our research capabilities, as well as being better positioned to contribute to the knowledge, the body of knowledge in the fight against diseases. The importance of the next generation sequencing machine just acquired by this institution in this era of COVID-19 pandemic cannot be overemphasized. You recall that the mantra of this present administration is next level agenda. Every time and then you hear next level agenda. But what NIMR has done is to move ahead of us. So NIMR is not talking of next level agenda, but talking about the next generation. The world has grappled with one of the highest mortality and morbidity incidences in the history of mankind. Furthermore, the ability of the SARS-CoV-2 virus to mutate, thereby changing its transmission dynamics and possibly escaping available vaccines and therapeutics, has pressured the world to conduct massive parallel sequencing of the SARS-CoV-2 virus. And this has invariably helped in making vital public health decisions. Let me pause at this juncture and say that the DG, I hope this assignment here today will be given enough publicity. Why am I asking for that? If you follow the sequence or the timetable of the ministry through the National Primary Healthcare Development Agency, members of the PTF, the Presidential Task Force on COVID-19, which I am member, are expected to be vaccinated before the camera today. And I'm here in Lagos. Let some people start saying, Senator Mamora ran away. Please, let them know that I came here. I'm not afraid to take the vaccination. I am not one of those conspiracy theorists. I made it clear at the rollout that those who peddle this conspiracy theory, two things they are doing, probably unknown to them. First is to desecrate the memory of people that have succumbed to COVID-19. That's the first thing, and that is very unfortunate. There are people all over the world that have lost loved ones due to COVID-19. So if people say there is no COVID-19, then that is making nonsense of the memory of these people that have died. The second thing which I made clear, and I've always said this, is that it is a disservice to the frontline health workers who stake their lives that all of us may be safe. That is the second thing. But if the people, if they don't know, my prayer is like that of our Lord Jesus Christ: Father, forgive them, but they know not what they are doing. Nigeria did succeed in ramping up PCR testing, which was hitherto not popular prior to the arrival of COVID-19. From only 4 PCR laboratories in the country at the inception of this pandemic, we now have over 100 of such laboratories. So, if you like, you may say that COVID-19 pandemic is a blessing in disguise. We are also making efforts in ramping up sequencing of the virus in order to support our sequencing infrastructure in the country. Through our networks, new strains have been identified in Nigeria. In addition to the B117, B135, and other variants of concern making rounds in the world. Today, a new next-generation sequencing machine with a robotic nucleic extraction and sample preparation system at the Nigerian Institute of Medical Research will be commissioned to support the country's effort in the real-time monitoring of variants of SARS-CoV-2 in our nation. The next generation sequencing machine setup will not only serve in the molecular surveillance of SARS-CoV-2 infectious agents such as Lassa fever virus, yellow fever, Ebola, and any other infectious agent characterized by the genetic code. Other areas of life science, next generation sequence research, such as transcriptomics, genetic polymorphisms, and epigenetics, can be achieved using this newly installed equipment. I therefore encourage our scientific community in the research institutions, healthcare facilities, academia, biotechnology, and pharmaceutical industries to continue to collaborate so as to ensure we make efficient use of the next generation sequencing machine to produce much needed sequencing data needed for public health decisions. While congratulating NIMR for this laudable achievement, I urge you to put in place a sustainable maintenance system that will guarantee availability of the machine to serve the institution for a very long time to come. Distinguished ladies and gentlemen, I thank you for your kind attention.
Members of your entourage, distinguished ladies and gentlemen, I want to specifically commend Director General for bringing you here again in 2021. And this committee is really very unique. And I want to use this opportunity to make an observation. Some of us know you as far back as when you were the Honorable Speaker of Lagos State House of Assembly. And we know that Nigerian Institute of Medical Research is domiciled in the Center of Excellence like Lagos.
The extraction kits for RNA extraction kits and our CIMA and so on, things that will make testing for COVID faster and cheaper that NIMR has really gone ahead to produce. So we are not hearing anything that is being used So I don't know if you will help us to make it, to be used in Nigeria. It will save the country a lot of money. And we have gone far to do that. Yeah, NIMR is really working under our president's vision. Please, sir, if there's anything we can do, we'll appreciate it so much. Thank you.
Thank you. When I was able to call on the speaker. You go. But I can assure you that as many people as you'll be willing to host, we can bring them. And if they're not here, it's because we have not really invited them. Okay? But since you have a large heart, now that I know, so when next I'm coming, I can assure you that you will have people from the government of Lagos State accompanying me here. Thank you very much. Professor Ezeji, yours has to do with your concern regarding the act which still locates you in the Federal Ministry of Science and Tech, right? Okay. We'll work on it, but you also have to give the push so that we, by way of reminding us, it's just a matter of amendment. The act, and that's the legislative process. We'll do it. At least just to give that legal background. I'm sure it doesn't stop you from what you're doing, is it? It doesn't. But just to follow the due process and establish that due process, it will be done. Okay? And Professor Odunope, I think I got it right. Yeah, I got it right, right? Right. Thank you very much. I'm happy that you are giving the floor so that we don't leave this place with a sense of guilt that women have been marginalized again. So, thank you. Just in line with what I said earlier on, we will continue to leverage as much as possible because we always talk of this political will and political leverage, which we need. And each time I have opportunity to talk to people, and the way people talk about, a lot of things, the first thing I tell them is seek ye first the kingdom of politics, and all other things shall be added unto you. Because that is where everything starts. Everything. And so it's not just here. Globally. And that's why the likes of me continue to encourage more and more people to just show interest in what happens in the political terrain. Because whether you like it or not, the decisions that affect every one of us, these decisions start from the political terrain. So, we will do more, we will push harder, and get what is due to us. And like I said, when you get better, we also get better. Thank you very much. I call this tape declare upon the Central Sequencing Laboratory. Amen. Medical Research Central Sequencing Laboratory, commissioned by Dr. Olorunnimbe Mamora, Minister of State for Health, today, 8 March 2021.